Good evening everyone, I'm Dr. Maria. 29th September is celebrated as the World Heart Day, and on the World Heart Day we focus on one of the greatest health challenges of our time, which is the cardiovascular disease. Well, about 6 million new cases and 1.6 million deaths are caused every year because of the same. Even before the pandemic and after pandemic, post-pandemic, cardiovascular disease has always been the leading cause of death around the world. So today, on the World Heart Day, we focus on spotlighting this greatest health challenge that is occurring around the world. The 2022 theme of the World Heart Day is Use Heart for Every Heart. Well, use heart basically means to think differently, to make right decisions, to act with courage, and to make efforts to bring changes in your health status and the heart cell status. And for heart basically means whatever you do, symbol or the greatest extent of activity, to make sure that it reaches as many people as possible, that it can also bring the best of their heart, or like it helps them to have a better heart health status. So here with me today is Dr. Tiny Nair, the head of Department of Cardiology of PRS Hospital, Trivandrum. Such a pleasure to have you, sir.
Oh, thank you, Maria. Today we have an excellent host here, Dr. Maria. And as you can see, she is prepared a host of questions, huge number of questions, general doubts about cardiac problems which she would ask us. And if you have a question, do put it in the chat box so that we can try to answer it as we go along. Yes, Maria.
Okay, so let's start. Well, കഴിഞ്ഞ 2 ദിവസമായിട്ട് ഞങ്ങളുടെ PRS ഫോറത്തിൽ കുറച്ച് ക്വസ്റ്റ്യൻസ് ഹാർട്ട് ഡേ സംബന്ധിച്ച് കുറച്ച് ക്വസ്റ്റ്യൻസ് കിട്ടിയിട്ടുണ്ട്. അതിനെ ബേസ് ചെയ്തിട്ടായിരിക്കും ഞാൻ സാറിനോട് ക്വസ്റ്റ്യൻ ചോദിക്കുന്നത്. ഉണ്ടെങ്കിൽ ഡെഫിനറ്റ്ലി കമൻറ്റ് ബോക്സിൽ ടൈപ്പ് ചെയ്യാവുന്നതായിരിക്കും, അതെനിക്ക് റിസീവ് ചെയ്യുന്നതായിരിക്കും, സാറിനോട് ചോദിക്കുന്നതുമാണ്. So let's begin.
Yes.
The first question is, so what are the dietary changes I should introduce into my life after being diagnosed with heart disease? This is the first question I received.
Oh, first of all, you are too thin. You should not too much diet. I suppose. See, the point is, diet is very important in both prevention and treatment of heart disease. Right. So, we should first understand that our diet in the നമ്മുടെ ഡയറ്റിൻ്റെ അകത്ത് കുറേ കോമ്പണൻസ് ഉണ്ട്. ഓക്കെ, വി ഹാവ് പ്രോട്ടീൻ, വി ഹാവ് കാർബോഹൈഡ്രേറ്റ്, വി ഹാവ് ഫാറ്റ്. നമ്മൾ ഏത് ഫോറമിൽ പറയുമ്പോഴത്തേക്കും അയ്യോ ഫാറ്റ് കഴിച്ചാൽ ഹാർട്ടിന് അസുഖം പിടിക്കും, ഫാറ്റ് കയറി എല്ലാം ബ്ലോക്ക് അടിച്ച് വി വിൽ ഹാവ് എ പ്രോബ്ലം ഓഫ് ദി ഹാർട്ട്, റൈറ്റ്? സോ ദാറ്റ് ഈസ് അണ്ടർസ്റ്റാൻഡബിൾ. ഫാറ്റ് ആണ് ഏറ്റവും വലിയ വില്ലൻ, റൈറ്റ്, ഇൻ ക്രിയേറ്റിംഗ് ഹാർട്ട് ഡിസീസ് in a normal person like you and me, as well as people who have got heart disease. So first of all, we should not take too much of fat, right? That is point number 1. Now, point number 2 is fat in a pala type on there, okay? Onnu aanu nammal parayum saturated fat. This saturated fat is something that is the worst kind of thing that can create heart problem, while we have some fats called unsaturated, polyunsaturated, monounsaturated. This kind of fats actually are not that bad, right? And then there is a fat called trans fat. അയ്യോ സാറേ ഇതൊക്കെ എന്തോ ടെക്നിക്കൽ ഭാഷ പറയുന്നത്. ഹൗ ഡു ഐ നോ എൻ്റെ ഡയറ്റിൽ സാച്ചുറേറ്റഡ് ഫാറ്റ് ഉണ്ടോ അൺസാച്ചുറേറ്റഡ് ഫാറ്റ്? സിമ്പിൾ. ഇഫ് യു ഫൈൻഡ് the fat that you are talking about is solid, say butter, ghee, they are saturated fat. If you find the fat you use is liquid, it's generally unsaturated fat, at least a component of it, oil, unsaturated, right? But if you take that unsaturated fat and pass some hydrogen through it, it becomes kind of saturated, and that gives us what we call as the trans fat. That's the motion. So worst is trans fat, bad is saturated fat, okay-ish is polyunsaturated fat. Okay, that is about the fat. Now, the dietary worldwide guidelines, and we should have about roughly 30% of our calorie from fat. See, Maria, we should highlight and everybody should understand, fat is not bad.
Right.
For your body to function, for your brain to function, you need fat, right?
Right.
It should not go beyond 30% of your calorie intake.
Right.
And predominantly of that should be polyunsaturated fat. Okay,
Right.
that is point number one. But what I want to tell you here and tell everyone is that Kerala there is something else. Kerala there is absolutely different diet. For example, morning we take dosa, we take idli, we take putta, we take idiyappam, we take rice, we take chapati. What are they? They all carbohydrate on it. So right from morning till afternoon and night, we overload ourselves with a huge amount of carbohydrate.
True.
Carb. അതാ കഴിയും. കൂടെ കുറച്ച് ഫാറ്റ് കഴിച്ചു, കൂടെ കുറച്ച് ഒരു പ്രോട്ടീൻ കഴിച്ചു, ഒരു ചിക്കൻ പീസ് കഴിച്ചു. അതാണ് പ്രോട്ടീൻ. Now this carbohydrate in our body, if we take overload them, the liver would produce something called a triglyceride. Triglyceride, it's a fat, right? And that fat can give rise to all kinds of cardiac issues. So what are we trying to do? It should be a balanced diet where 40 to 50% of your dietary source should be carbohydrate, 30% protein, and 30% fat. So an intelligent mix would be good. So you would say that, sir, fat, what should be? So more of vegetables, more of fruits, less of rice, chapati and everything, little bit of dal and proteins, and maybe if you are a non-vegetarian, some kind of protein to supplement. Have fruits, have nuts, and that's it. Your diet is good enough. And also it is worthwhile that everybody should get the calorie requirement estimated. For example, somebody who is very sedentary, the calorie requirement actually may be much lesser than somebody who is extremely active or runs or jogs or carries weight on their head or does physical work. So, if possible, meet your doctor or a dietitian and ask as to how much calorie I require. And then if you want, you can actually split up and have a very good diet. Whether you have a heart disease or no heart disease doesn't matter. If you have already a heart disease, be careful about your diet. But general guidelines are very clear. Not too much of fat, not too much of carb, and not the bad fat.
Okay. So so from what you said, can I ask you this question? So what about the laborers out there, like the hard-working population, the extremely hard-working population, the ones, the fishermen or the ones who are into the hard work. So like you mentioned about rice and chapatis and all being a good source of fat. So what do we do about that? They need that for lunch.
Yeah, they need, but again that needs to be tailored, right?
Okay.
See, the amount of calorie that Dr. Maria here I need, because we are sitting and seeing patients or sitting in front of a system, or you're an IT engineer right in front of a system, your calorie intake requirement is very low, right? So you can manage perhaps with 1500 calories, but a person who does hard work, he spends calories. So he needs more calorie, but the point is, even if he takes more calorie, that ratio of about, let's say, 40 to 50% of his diet coming from carb, 30% from protein, and 30% of fat, kind of good fat, still remains same.
Okay. Good. So the next question is, so there was this question like, what is the relationship between smoking and heart disease? So the question was like, is smoking 1 to 2 cigarette as injurious as smoking a pack? Something like that was the question.
Obviously not. The thing is, we used to say that if you want to know 5 things about prevention of heart disease, 5 things, okay. First, stop smoking. Second, stop smoking. Third, stop smoking. Fourth, stop smoking. And fifth, stop smoking. We mean that this is one of those risk factors that is eminently reversible, right? So if you are stopping smoking immediately in the next maybe 5 years, your risk substantially come down. So stop smoking. Now if you ask that, okay, somebody is smoking 2 cigarettes versus somebody smoking heavily, obviously heavy smoking is far more harmful, but understand one simple logic here. You must have heard me talk about passive smoking, right? Suppose I smoke, okay, my wife and my kids get exposed to smoke. That is what smoke I am smoking inside the room or my bedroom, and they inhale the same air. Adinani passive smoking. So even passive smoking is bad, and that is the reason why we say bus station, railway station, airport, hotels, hospitals, smoking padilla. എന്തുകൊണ്ട് പാടില്ല? പാസീവ് സ്മോക്കിംഗ് പാടില്ല. And you are talking about, can I have 3 cigarettes a day? Because ഈ ക്വസ്റ്റ്യൻ നമ്മൾ എപ്പോഴും കേൾക്കും. ആൾക്കാർ വന്ന് പറയും, ഡോക്ടറെ ഞാൻ രാവിലെ ഒന്ന് ഉച്ചയ്ക്ക് ഒന്ന് ബാത്റൂം പോകാൻ മുമ്പേ ഒരു സിഗരറ്റ് വലിക്കും, കുഴപ്പമില്ലല്ലോ, ഭയങ്കര കുഴപ്പമാണ്. If you have a narrowing of an heart artery and you have a susceptibility to develop a heart attack, those couple of cigarettes are enough to push you into a cardiac problem, right? One more thing, you have not asked me, but I would try to take it up and tell our listeners, e-cigarette. But ഭയങ്കര ഫാഷനാണ്, ഭയങ്കര ഫാഷൻ. ഇഫ് യു ആർ ട്രാവലിംഗ് അബ്രോഡ്, ഒരാൾ വന്ന് ചെവിയിൽ പറയും, വരുമ്പോഴത്തേക്ക് 2 e-cigarette കൊണ്ടുവരുന്നത്. E-cigarette, people think it is safe. They are not safe. Okay, if you have read, what do people call e-cigarette? Vaping.
Vaping, yeah.
Isn't it vaping? Because the e-cigarette has a heater that converts the chemical into vapor.
Right.
Matter smoking on it, right? Smoke. So this doesn't create a smoke, but it vapes.
Right.
And you inhale the vapor and understand that the vapor's particle size are much more smaller. It is like your inhaler or your nebulizer.
Right,
so it straight goes into your lungs, right? And what does it contain? Nicotine. Nicotine. So do you think nicotine is safe?
No.
Certainly not. So e-cigarette is not as bad as usual cigarette, but understand that it is still bad. And that's why today India government prevents you from importing or selling e-cigarettes in India. So smoking is bad. Do not smoke. And if you smoke only a few cigarettes, stop smoking. Now there is something else here. Something else here. Even if you don't ask me, I will add it here. Taking time, and that is it. See, you take an alcoholic, right? He damages himself, and you say, why are you drinking? You are damaging your liver, you will die, right? But the smoker is not only damaging his health, he is killing me and you, right? Because of his passive smoke. So the point is, if there is a smoker who is smoking in a public place, you and me, it is our moral duty to go ahead and tell him, you are not supposed to smoke here. I mean, that is our duty, right?
Right.
And today, if you actually see the data, in Kerala, smoking is coming down.
Right.
You know, alcohol is also coming down.
Okay.
Yes. In 2015, in a survey, we found that 57% respondent, men in Kerala, said that they take alcohol regularly. 57%.
Okay.
And today, the last survey says 19.8%.
Okay.
Maybe some people would not have said because they're scared of their wife or their parents, but the incidence of alcohol is coming down, which is good for us.
True.
You might say, why am I not seeing a difference? You would see a difference 10 years down the line.
Definitely. Any small change makes a difference, like little steps to a bigger impact. ഇല്ല, expect ചെയ്യുന്നുണ്ട്. പക്ഷെ മാറ്റങ്ങളുണ്ടല്ലോ. So the next question, moving on. Why are men more prone to heart disease compared to women?
A very tough question, Anand. See, this has been worrying the medical community for what? Years. സ്ത്രീകൾക്ക് till they menstruate, ആ പീരിയഡിൽ അവർക്ക് ഹാർട്ട് ഡിസീസ് വരത്തില്ലെന്നല്ല, കുറവാണ്. A lot of research. Initially we thought it is estrogen, progesterone. അപ്പോൾ we tried giving post-menopausal women estrogen and progesterone to see that will their heart attack come down. It didn't. We started giving men small dose of estrogen and progesterone to prevent heart attack. Nothing happened. So the simple answer is we don't know. But couple of things here. As women get older and older and get into the post-menopausal phase, their incidence of heart attack equals that of men. Number one. Second thing, if a lady is diabetic, that protection from heart disease goes away. In fact, my professor of cardiology used to tell that if you see a young lady coming with a heart attack, even without testing, I can tell that she is a diabetic. So diabetes takes away that so-called protection of women from heart disease. And Maria, I will tell you something, that the misconception among people. What is the commonest cause of death in women? Mortality. Commonest cause is heart disease. See, 1 in 5 women dies of heart disease. And if you add stroke, 1 in 3 deaths are because of stroke or heart disease, right? Vascular disease. despite the fact that it's less than men. So even in women, the leading cause of death is heart disease. Cancer is only next. So there was a big survey among young ladies in college. Everybody said breast cancer, uterine cancer. No, the leading cause of death in a lady is still heart disease. അതുകൊണ്ട് heart disease prevention ആണുങ്ങൾക്ക് പെണ്ണുങ്ങൾക്ക് equally important ആണ്. But of course സ്ത്രീകൾക്ക് കുറവാണ് till a certain age, after which of course the incidences are nearly equal. Yes.
Nice. That was very informative. Okay, the next question is, we say blood clots cause heart attack. So how do we know if we have a clot formed in our body, or is a clot in any other part of our body? So,
See, not every heart attack is caused by a blood clot. See, the problem is that the heart arteries, right, as long as they're healthy, the interior of the artery, we call them endothelium.
right.
The endothelium is like, very glistening surface. So blood clot doesn't form there.
Right.
So blood clot tends to form only when the interior is damaged, what we call as atherosclerosis. The atherosclerosis process വരുമ്പോഴത്തേക്ക് ആർട്ടറിയുടെ interior damaged ആകുമ്പോഴത്തേക്ക് അവിടെയാണ് ഈ clot വരുന്നത്. Okay. So like you said, how do I know that whether I have a clot somewhere?
Right.
There's no way, right? No
True,
way.
true.
I don't know, you don't know. But there are clues. For example, if there is a tendency for clotting in the brain arteries, you get something called TIA, transient ischemic attack. And they're very innocuous. People might ignore them. അപ്പോൾ ഒരാൾ പറയും സാറേ അന്ന് ഞാൻ നടക്കും പോകുമ്പോഴത്തേക്ക് പെട്ടെന്ന് എൻ്റെ കൈ ഇങ്ങനെ കുഴഞ്ഞു പോലെയാണ് ഒരു വീക്കായി 5 മിനിറ്റ് കഴിഞ്ഞെല്ലാം ശരിയാ അത് ചുമ്മാ ഞാൻ ഇങ്ങനെ കടന്നുറങ്ങി കാണുമായിരിക്കും. Somebody would come and say that ഞാൻ പെട്ടെന്ന് എനിക്ക് സംസാരം എന്തോ പോലെ ആയി ഒരു 10 മിനിറ്റ് പിന്നെ എല്ലാം ശരിയായി അതെന്തോ അറിയില്ല. TIA. And if there is a TIA, it is a very early warning that in your cerebral circulation, brain circulation, there is a tendency for a blood clot, which means you have a higher tendency for a clot in the heart and clot in the other arteries. Similarly, leg. A lot of people would come and say that as I walk, ഒരു 100 മീറ്റർ നടക്കുമ്പോൾ കാല് ഭയങ്കര കഴപ്പ്, I need to stop. And then I can again walk. What? It is exactly like the heart pain that people describe. We call it claudication.
Right.
Claudication എന്ന് പറഞ്ഞാൽ as the person walks, കാലിലേക്ക് sufficient blood
പോകുന്നില്ല.
and he gets so if you have a claudication, if you have an evidence of a TIA, you can say yes, there's a tendency for blood clot and that might affect the heart.
True. Nice. ഇനി അടുത്തത് ഈ മീനെണ്ണ ഗുളികയുണ്ട് ഈ cod liver oil. How effective is it? Like how effective is consuming it to bring the cholesterol under control? Like how effective can it be?
I will tell you. See, my mom is a Bengali, right?
Right.
She's no more. But then all her life she believed that fish guliga is a treatment for everything. She used to give me one every day, thinking that my color will improve and one day I will look like her. She used to give it to my dad, telling that his arthritis will improve. She used to give one to my granddad, telling that his memory would improve. She would believe.
Right.
And all of us used to actually laugh at it. The point is, why this came into perspective is because people, for example, Eskimos, okay, they eat basically diet of fish. And these are sea fish which has lot of fish oil. അപ്പോൾ അവർക്ക് ഹാർട്ട് അറ്റാക്ക് ഭയങ്കര റെയർ വരത്തില്ല. അപ്പം എസ്കിമോസ് ദോസ് ഹു ലിവ് ഓൺ ഫിഷ് ഡയറ്റ് അവർക്ക് ഹാർട്ട് അറ്റാക്ക് വന്നില്ലെങ്കിൽ നമ്മളെല്ലാം കൂടി ഈ സീ ഫിഷ് പിടിച്ച് അതിന് ഓയിൽ ഉണ്ടാക്കി കഴിച്ചാൽ നമുക്ക് വരത്തില്ലല്ലോ അങ്ങനെ ഒരു ബിലീഫിന് ആണ് ഇത് ഉണ്ടാക്കി. ബട്ട് ദി പോയിന്റ് ഈസ് സ്റ്റഡീസ് ആഫ്റ്റർ സ്റ്റഡീസ് ഷോഡ് ദാറ്റ് their effect is very minimal. But very recently we had a kind of sea fish oil. അതിൻ്റെ ഒരു പാർട്ടാണ് ഇക്കോസപ്പൻറ്റ് ഇഥൈൽ പറയുന്നത്. It is one of those component of the sea fish oil which showed that it reduces triglyceride. If there are two fats in the blood. We have cholesterol with triglyceride. Those are high triglyceride. We had very little treatment for them. And this icosapent-ethyl tends to lower triglyceride and tends to reduce cardiovascular event rate in 2 major trials which has come very recently. So I think they are kind of protective, but they're not a panacea. You should not go on eating thinking that, okay, now smoke ചെയ്യാം, drinks അടിക്കാം, എന്ത് വേണമെന്ന് ചെയ്യാൻ വേണ്ടി മീൻ ഗുളിക കഴിച്ചാൽ heart disease വരില്ല. That is wrong. And we don't really recommend that you go and everybody take fish oil. No, no, no. Because നമുക്ക് ഇവിടെ കേരളത്തിൽ a common thing is that parents bring huge bottles,
Right.
telling that എൻ്റെ മോൾ US-ൽ ഉണ്ട്, ഇത് കൊടുത്തയച്ചു, ഡെയിലി ഒന്ന് കഴിക്കട്ടെ എന്ന്. It'll be like 200 tablets of fish oil bought from Walmart,
Right.
thinking that it will prevent some kind of heart disease. We don't recommend that everybody takes that because there might be stomach upset to any other thing. But specific conditions, they might be useful.
Okay, that was very informative, especially that Eskimo part. Eskimo part was really good. ഇനി ഇത് പറഞ്ഞതുകൊണ്ട് തന്നെ സാർ ഈ ലൈക്ക് വെരി കോമൺ പീപ്പിളുടെ ഇടയിലുണ്ട് ഈ ഗുഡ് കൊളസ്ട്രോൾ ബാഡ് കൊളസ്ട്രോൾ എന്ന് പറയുന്നൊരു ഇതുണ്ട് ടോക്കുണ്ട്. അപ്പം അതിനെപ്പറ്റിയും പിന്നെ എന്താണ് ഞാൻ നോർമലി മെയിൻറ്റെയിൻ ചെയ്യുന്ന ഒരു കൊളസ്ട്രോൾ ലെവൽ ടു ഹാവ് എ ഹെൽത്തി ഹാർട്ട്, അതിനെക്കുറിച്ച് ഒന്ന് എക്സ്പ്ലെയിൻ ചെയ്താൽ.
ബ്ലഡിൽ സർക്കുലേറ്റ് ചെയ്യുന്ന ഫാറ്റാണ് കൊളസ്ട്രോൾ. അപ്പോൾ ഈ നമ്മൾ ഒരുമിച്ച് കൊളസ്ട്രോൾ പറഞ്ഞാൽ ഇഫ് യു ടേക്ക് കൊളസ്ട്രോൾ and look at the kind of lipids that circulate in our blood, they are different depending on the molecular size or the particle size. Now we should understand that fat don't get dissolved in water, right? So you put a fat in the heart and you think that it will go to my periphery, it doesn't. So these particles are, outside they are water soluble.
True.
And inside there is fat.
True.
So they are like a particle which can easily float in water, but they carry fat. So pala type ഉണ്ട്. അതിന് ഒരു type ആണ് HDL cholesterol, which is high density lipoprotein. Now this HDL cholesterol is protective. ഇത് നമ്മുടെ cleaner പോലെയാണ്. So HDL cholesterol travels everywhere in your tissues, starting from liver and goes and cleans the periphery and prevents blockages. അപ്പോൾ HDL അത്ര കൂടുന്നു അത്ര നല്ലതാണ്. So ഈ ചോദിച്ചില്ലേ ഏതാണ് നല്ലത്? So 45 milligrams in the male HDL ഉണ്ടെങ്കിൽ it's good, and if it is more than 55, it is very protective.
Good.
But the point is, HDL cholesterol is partly genetic. So we have very little that we can do about it.
True.
Apart from exercise. ഇതിനൊരു ചെറിയ ചോദ്യമുണ്ട്. People will come and ask, ഞാൻ വായിച്ചിട്ടുണ്ട് alcohol കഴിച്ച HDL കൂടും. But that alcohol induced HDL elevation do not protect you from heart disease. Very clear. There is no data that alcohol culture rise in HDL doesn't protect you from heart disease. If you wish to take alcohol, you take it, but don't piggyback it on the logic that you are taking to raise your cholesterol, HDL cholesterol. LDL is the bad cholesterol.
Right.
So low density lipoprotein. In fact, all the cardiac disease that we talk about, blockages, heart attacks, angina, all have been correlated very linearly to LDL cholesterol. Okay, but today we have drugs like statins, which are very potent in reducing LDL cholesterol. We have many drugs, and as we lower LDL cholesterol, the bad cholesterol, we see that incidence of heart attacks, incidence of strokes, incidence of acute coronary syndrome, all diseases which result from blockage in the heart tends to calm down. So LDL cholesterol കുറയ്ക്കണം. LDL എത്രയും കുറയ്ക്കുന്നത് എത്ര നല്ലതാണ്. എല്ലാവരും ചെല്ലുമ്പോൾ സാറേ ഇത് ഭയങ്കര കുറഞ്ഞു പോയോ. See, a newborn has an LDL cholesterol between 30 and 50. 30 and 50. Right. And നമ്മുടെ LDL cholesterol നമ്മളെ പറയുന്നത് at least 100 വെക്കണേ. 100 മേളിൽ കൂടി പോകണ്ട. Today, the American Association and Indian Association, we put that the good level of LDL cholesterol should be below 70.
Okay.
And if you have diabetes or if you have heart disease already, it should be below 55.
Okay.
So, we are actually lowering the goals over time because we've realized if you keep them lower, you are achieving better health, lesser heart attacks. അതിന് ഒരു ചെറിയ കാര്യം കൂടെ ഉണ്ട്. The longer the duration you keep your cholesterol controlled, more is the benefit. അപ്പോൾ പണ്ട് നമ്മൾ പറയും കൊളസ്ട്രോൾ കുറച്ചുകൂടി നോക്കൂ, ഒരു വർഷം കൂടി പോട്ടെ. No. Now we say that this persistent high LDL damages your endothelium.
Okay.
So longer the period you keep it normal, your chance of developing thickening of that endothelium is far, far less.
Very high.
Atherosclerosis is very low. Heart disease in chance കുറവാണ്.
Okay. ഇനി നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ എന്ന് പറഞ്ഞാൽ how do we know how healthy and functioning our heart is? Very simple
Very
and
simple.
very complex.
So you tell your viewers, I really don't know. See, the point is that I take a routine. Ask yourself that, do you have a symptom? Okay, you are walking daily, doing all your work. So when we see a lot of patients who come for fitness for a surgical procedure. You know, Maria, what we asked first?
Right. What?
How active are you? Sir, I'm a housewife. Do you do everything? Are you going to move the floor under clean bathroom? This lady has no significant heart disease because she is active entire day, and without a symptom she does everything. So first thing is that, are you able to do everything, daily housework or your daily course, without a symptom? The symptom may not be chest pain, but you might still feel fatigue. You might feel that I'm unable to do it. Maybe I'm breathless, whatever. Which means you need to check up. Do you have a cardiac issue? That is point number one. So symptom. And if, see, the complexity comes in because there are diseases like diabetes, okay, where there may not be symptoms. നമ്മൾ ചിലപ്പോൾ പേഷ്യൻസിനെ കാണും, ഭയങ്കര ECG ചേഞ്ച്, അയ്യോ ഇതെന്താ എപ്പോൾ തൊട്ടേ ചെസ്റ്റ് പെയിനോ എനിക്ക് ഒരു പെയിനും ഇല്ല. ദി പേഷ്യൻ്റ് ഇസ് ഡയബറ്റിക്. സോ ഡയബറ്റിക് പേഷ്യൻസ് ക്യാൻ ഹാവ് സൈലൻറ്റ് ഇസ്കീമിയ. നമ്മുടെ ഡയബറ്റിക് ഒരു പേഷ്യൻ്റെ കാലിൽ ഒരു മുള്ളുകുത്തി അറിയത്തില്ല, റൈറ്റ്? അതേപോലെ തന്നെ ദേ വോണ്ട് നോ ദി പെയിൻ ഓഫ് ഹാർട്ട് പ്രോബ്ലം ഓർ ഹാർട്ട് അറ്റാക്ക്, സൈലൻറ്റ് അറ്റാക്ക്, റൈറ്റ്? സോ അതുകൊണ്ട് സിംറ്റം മാത്രം വെച്ച് പോകാൻ പറ്റില്ല. Then we need to do tests, blood checks, risk factors, biomarkers, ECG, echocardiogram, even a treadmill test that would show us, is there a blockage or not? But this is a very difficult question. We have people who apparently are very healthy and we have picked up they have heart disease. There are people who have got abnormal ECGs and we thought they might have a block, and when we do an angiogram they are normal. So, but generally, if you are doing your exercises regularly, if you have no symptoms, it is very unlikely that you have a major cardiovascular defect.
Okay. So, since we brought up that word checkup, how effective is periodical health checkup? And what are the kind of checkup, like e common man, സാധാരണക്കാർക്ക് ഒരു ചെക്കപ്പ് എന്ന് പറയുമ്പം നമുക്കറിയാം ഫിനാൻഷ്യൽ കൺസ്ട്രെയിൻസ് ഒക്കെ ഉണ്ടാവും. അപ്പം എന്ത് കൈൻഡ് ഓഫ് ചെക്കപ്പ് ആണ് ചെയ്യാൻ പറ്റുന്നത് ടു നോ ദ ഹെൽത്ത് സ്റ്റേറ്റസ്, ദ ഹാർട്ട്സ് ഹെൽത്ത് സ്റ്റേറ്റസ്?
Heart health status in a first is, let's say, somebody who does not have any symptoms. We say that once you cross a certain age, generally accepted in India is 35 years, you should have at least one blood test done, whereby you need to check your sugars, you check your lipid levels, so that you know your bad cholesterol, your good cholesterol, and whether they are normal or abnormal. If your lipid profiles are normal, your sugars are normal, you need to check out once every 2 years. But if they are normal, we recommend once every 6 months, check out and see, are they increasing to a level where you need a medicine or not. That is for the blood levels. A routine ECG is recommended as a part of health checkup, because ECG can vary from person to person.
Yeah.
Or if you have a baseline ECG and if you go to a hospital with a muscle pain, and if your baseline is abnormal, they might say, oh my God, your ECG is abnormal. Right? If you say, my ECG is here in my cell phone, it's taken 2 years back, or looks similar, so you have no problem. So we always advise that above the age of 35, possibly you can get a health checkup done, where you get an ECG done, blood checks done, and that's it. The rest of it your doctor decides. For example, this namali parayunne is general. If individual, ചില ഒരു ആൾ വന്നു, അയ്യോ സാറേ എൻ്റെ ഫാമിലിയിലെ എൻ്റെ അച്ഛന് അറ്റാക്ക് വന്നു 40 വയസ്സിൽ, എൻ്റെ സിസ്റ്ററിന് അറ്റാക്ക് വന്നു 35 ഏജിൽ, എൻ്റെ ചേട്ടൻ 50 വയസ്സിൽ കുഴഞ്ഞു വീണു, എൻ്റെ വേറൊരു അങ്കിള് സഡനായിട്ട് സ്ട്രോക്ക് ഉണ്ടായി. So we tell them they have a very strong family history. So this kind of protocol, what we said, above the age of 35, you get your checkups done once in 2 years and all that, doesn't hold good, because this person has a very high risk.
Yeah.
So in them, our strategy should be different. See, understand that our times have changed, right? When we were students, there was a treatment for you, me, everybody here. But now what we are talking about is called precision medicine or personalized medicine. So treatment which is good for me may not be good for you.
True.
So it depends on your genetic background, it depends on your environment, your family history, and what would be the best for you. So precision medicine is something we should spend a little time for the patient and decide what is best for them.
Okay. Pinna, next question is, what are the measures we should induce in our lifestyle to have a healthy and functional heart? So you answered that. So the tagline question was, stress is a very common phenomenon in our daily life. പണ്ടത്തെ പോലെയല്ല, ഇപ്പോൾ എല്ലാവർക്കും ഭയങ്കര സ്ട്രെസ്സാണ്. 10th ഗ്രേഡ് സ്റ്റുഡൻസിന് പോലും സ്ട്രെസ്സാണ്, എല്ലാവർക്കും സ്ട്രെസ്സാണ്. അപ്പം സ്ട്രെസ്സും അറ്റാക്കും അതിൻ്റെ ഒരു കോറിലേഷൻ എന്താണ്?
Yeah, I think it's a very good question. And I think the first thing we should teach our children is to how to handle stress. See, whether you are working as a doctor, whether you're a housewife, whether you are a CEO of a corporation, or whether you are a student of 10th standard, you have stress of different kind. But we should understand that stress, we normally say because of the situation, right? Exam വരുന്നു സ്ട്രെസ് ആണ്, എനിക്ക് നിറയെ പേഷ്യൻ്റ് ആണ് സ്ട്രെസ് ആണ്, ഓഫീസിൽ ഭയങ്കര സ്ട്രെസ് ആണ് because the budget is tight and all that. That is not stress. Stress is your response to your environment. ഞാൻ എല്ലാവരും എൻ്റെ പേഷ്യൻസിന് പറയും, see, stress is your response to the environment, because same environment ആയിട്ട് ഞാൻ ചിലപ്പോൾ സ്ട്രെസ്, അയ്യോ ഇത് എന്തുവാ മാറിയാൽ കൂളായിട്ടിരിക്കും, ഒരു കുഴപ്പമില്ല. So it is not the environment, right? It is your response to the environment. Given in the same environment, somebody would just enjoy the situation, somebody would be stressed up. So understand that response, all of us can change.
Right.
You can change, I can change, and we can train ourselves to change. Okay, I'm a doctor in a busy outpatients, hundreds of people are coming, people are saying, doctor, ini kornilla. Either I can get excited and I can get stressed out, and I can, oh my God, what is happening? Or I can, okay, come on, we'll see it.
Yeah,
right?
handle
So
it.
it is your response to the situation, environment. That is stress. Stress is not your environment at all, right? Number one. Second thing is stress response. For all animals, stress as a survival mechanism. So what happens is fight and flight. So our heart rate increases, our blood pressure goes up, and our body is ready to either run away or fight. But in the situation, like you said, 10th standard student, CEO of a company, this stress response is 24/7.
Right.
Right. Even in the middle of the night, you get a phone call from your patient, you are stressed up. So what is happening is, what was supposed to be a fire brigade truck is now being used daily for commute.
True.
And so, our system tends to get damaged, right?
True.
Ella problem on heartbeat koodunnu, blood pressure koodunnu, chance of cardiovascular disease comes down. So I think we should teach all our children, our patients, our neighbors, our family, our society as to how to handle the situation and kind of remain stress-free.
Nice. So again, the next question is, from what age onwards should I be expecting an attack to happen, or what age group is considered to be the ones in the risk zone? Is there an age group like that?
See, actually, if you look at all the Western data,
Right.
Western societies, heart attack tends to rise with age and tends to come somewhere around 60 plus, right? Myocardial infarction tends to occur 60, 65 age. Nowadays we see that it's a dual peak. The first peak comes at around 40s, between 40 and 50. If you come to our intensive care unit at any time, you would see that about 20%, 25% of patients are youngsters.
Oh.
Yeah. So they are normally background, our IT working, they're highly stress prone, they always sit in front of their system and work, no exercise. They get huge pay, so they can buy anything. And if you've gone to those IT parks, just across the corridor, you have got what? McDonald's, you have KFC, you have Subway, you have everything.
Bars, yes.
So you just order and eat. So they sit, moreover, they are working at what time? American time.
Right.
When America wakes up, it is our sleep time, so we don't care because we are earning money. All these boys are working regularly at night. So lack of sleep, time-bound projects, see, because the projects are time-bound, they get huge amount of money, and they also know that if I lose that project, the disaster will be huge, right? It is not a usual job. So these youngsters tend to get significant metabolic derangement. Their HDLs are low, their LDLs are high, their blood sugars are high, their blood pressures are high, they are obese, they are fat, they are unhealthy. And one group who gets a heart attack is this group. And that's why we always say that we should, by our corporate responsibility, we should tie up with the multinationals or larger companies and provide them with counseling, provide them as to how in their workspace they can build in some kind of exercise and a healthy habit, right? So I think inculcating a healthy habit is very important, and the age at which South Asians get a heart attack is much younger. But young age is we careful. അല്ലെങ്കിൽ ഈ വെസ്റ്റേണേഴ്സ് ദോസ് ഹു കം യു എസ് നിന്ന് നമ്മുടെ വിസിറ്റിംഗ് ആയിട്ട് വരുമ്പോഴത്തേക്ക് നമ്മുടെ ഐ സി യു കണ്ടവർക്ക് അതിശയമാണ്, അയ്യോ ഇത് എന്തോ ഇങ്ങനെ ചെറുപ്പം ഏജിൽ അറ്റാക്ക് വരുമോ? യെസ്, ഇൻ കേരള വി ഗെറ്റ് ഇറ്റ് ആൻഡ് അണ്ടർസ്റ്റാൻഡ് ദാറ്റ് ദിസ് ഈസ് മോസ്റ്റ് കോമൺ ഇൻ ദി സ്റ്റേറ്റ് ഓഫ് കേരള, most common in the state of Kerala, whereby we know that at a young age heart attacks are much more common. Is it genetics? Is it environment? Is it stress? Is it the food we eat? Or is it our stress like you? We don't know. But overall, we have a higher tendency to get a heart attack at a much earlier age.
I'm curious about the Kerala thing. Your series, I thought, must be in the metropolitan cities like.
Oh no, Kerala series is, see, there was a very beautiful article written by a journalist, I just remember offhand, who said that Kerala is a big town from north till south, dotted with toddy shops.
Yeah,
he wrote it because he thought there's no villages in Kerala.
Yeah.
Right. And you also don't have huge metros like Mumbai or Chennai or Hyderabad.
Bangalore,
right?
yes.
They're all small cities, but they're beautiful.
Yeah.
They have everything, but the entire state is a city. You don't have small villages.
Very true.
So our lifestyle is different, Kerala, with all this we should understand and appreciate our health status. See, there is something called infant mortality rate. Infants, how many infants die in the first, let's say, period of infancy out of 1,000? India number 30. Kerala 6.8, which is the dream number for European countries. Okay, it's the same as the US, Canada. Okay, look at life expectancy at birth. In the Kerala janikinna oru lady ki life expectancy at birth is 80.1 year, 10 years more than average Indian. So somebody said that if I want to be born like a girl, I want to be born in Kerala. Well, that is fascinating, right?
True.
Take male-female ratio. In Kerala, it is 1,000 males to 1,084 females.
True.
So at my home, my mom, my wife, my daughter can kick me out, right? which is the point is, the women power is so strong.
True.
Women literacy is 98%. So this state has fantastic health status, and this is where, if we bring in preventive cardiology, it would work out.
True.
So I think that is why the question that is posed by Maria, which you have posed to Dr. Maria, is so important, right?
Great. So, നമ്മൾ ഈ സാധാരണക്കാർ പറയും ഗ്യാസ് വന്നു എന്ന് പറയും. ഗ്യാസ് വന്നു, ഇപ്പോൾ എപ്പോഴും ഇ ആറിലാണ് ഡോക്ടറെ ഗ്യാസ് ആണ്. അങ്ങനെ വന്ന് നമ്മൾ കറങ്ങി തിരിഞ്ഞ് നോക്കുമ്പോൾ ഇ സി ജി ചേഞ്ചസ് ഒക്കെ വരും. അപ്പം ഈ നമ്മൾ ഈ ബ്ലോട്ടിങ്ങും ഈ cardiovascular ഡിസീസുമായിട്ട് വാട്ട് ഈസ് ദെയർ റിലേഷൻഷിപ്പ്, അവരുടെ ഒരു ബന്ധം എന്താണ്?
Whenever we talk about a heart attack, നമ്മൾ ഹാർട്ട് അറ്റാക്ക് പറയുമ്പോൾ എല്ലാവർക്കും അയ്യോ നെഞ്ചുവേദന വന്നു, അയ്യോ ഡോക്ടർ എനിക്ക് നെഞ്ചുവേദന ഇല്ല. അണ്ടർസ്റ്റാൻഡ് ദാറ്റ് മോസ്റ്റ് പേഷ്യൻസ് സേ വേദന അല്ല. നമ്മൾ ചോദിക്കും ഇത് നെഞ്ചിന് വേദന, അയ്യോ ഡോക്ടർ വേദന എന്തോ ഒരു ഡിസ്കംഫർട്ട്, സംതിങ് ദാറ്റ് ഐ ഹാവ് നെവർ ഫെൽറ്റ് ബിഫോർ, സംതിങ് ദാറ്റ് ഐ തോട്ട് ഐ വിൽ ഡൈ. It is like a 15 kilo weight pressed on my chest. Pain onnumilla. So, the word pain is not very commonly mentioned. In fact, if somebody comes and tells me that I have a severe pain here, I'll say go home and sleep.
Right.
Do I need to take an ECG? Or ECG avashilla. But angane pain, heart inde pain alla, right? So, the heart pain have different characters, right? It can come as a discomfort of the shoulders. discomfort in the jaw. People have gone to the dentist and said, pallu edukkanam, enikku pallu therikkunu, right? Discomfort in the back, they visit orthopedicians. And like Dr. Maria said, it's like discomfort of bloating in the stomach. Bloating in the stomach can be a symptom of heart problem. Okay, but you would say that bloating problem illada mentioned namal endekilum poi chicken fry edicha bloating undam, right? So if you think that it is unusual bloating, namal normal verunna pole alla, ഇന്നലത്തെ വന്ന പോലെ ഇതുവരെ അല്ല ഡോക്ടർ, ഇന്നലെ എനിക്ക് ഭയങ്കര ഗ്യാസ് പോലെ അതേപോലെ ഇതുവരെ ഫീൽ ചെയ്യാത്തതാണ്, അത് കയറി വന്ന ചെസ്റ്റിനെ എന്തോ തട്ടുന്ന പോലെ തോന്നി. ഇഫ് ഇറ്റ് ഈസ് അൺയൂഷ്വൽ, why not get a checkup? All that you need is to go to a nearby hospital, get an ECG done, maybe a blood test done, and if it is normal, you are fine. Okay, but the point is that if you have a symptom of bloating, it can be a heart attack, but if you take 10 people with bloating, 9 will have nothing, right?
Nothing.
So don't get upset that simple bloating next time you run to a hospital. But if it is unusual, it is not going away, persistent, and something that you have not felt before, endo unusual ആണ്, മാറുന്നില്ല, or it is related to your effort, നടന്ന 10 അടി പോയാൽ ഭയങ്കര ഗ്യാസ് പോലെ വരും, be careful that it might be related to a heart problem.
Okay. So a couple of questions has been sent to me from the queries. This is like, sir, Nina has sent me this question. Sir, cardiac arrest undayal engane manage cheyyam?
Cardiac arrest, see, this is a very important question actually. Don't smile at it or don't laugh at it. Cardiac arrest is not heart attack. Many people have an idea that cardiac arrest is heart attack. Heart attack konde cardiac arrest varam. Cardiac arrest means heart pettannu ninnu poi. Heart pettannu ninnu poi. It may not be heart attack also. It may be just because the cardiac rhythm has become irregular. Either heart rapid ആയിട്ട് ബീറ്റ് ചെയ്യുന്നു, അല്ലെങ്കിൽ ബീറ്റ് ചെയ്യുന്നില്ല, സഡൻലി പൾസ് പോയി തലച്ചുറ്റി ആൾ വീണു. ആ സമയത്ത് നമ്മൾ ചെയ്യുന്നത് ഈസ് വാട്ട് ഈസ് കോൾഡ് കാർഡിയോ പൾമണറി റിസസിറ്റേഷൻ, CPR. നിങ്ങൾ കണ്ടിട്ടുണ്ടാവും സിനിമയിലൊക്കെ ആൾ ചെസ്റ്റിനെ കയറി ചെസ്റ്റ് തംപ് ചെയ്യുന്നു, ഡിഫിബ്രിലേറ്റ് ചെയ്യുന്നു, ഷോക്ക് കൊടുക്കുന്നു, അതാണ് CPR. Now we are all advocating that every adult, whatever be your profession, എന്തു ചെയ്താലും ശരി, ഒരു ബേസിക് ലൈഫ് സപ്പോർട്ട് സിസ്റ്റം or CPR പഠിച്ചു വെക്കുക. In fact, we have asked all agencies to say that whether it is government, private, school, college, everywhere, those who are interested, teach them CPR. Nothing is lost, right? ഇത് ആർക്കും വെച്ച് പഠിക്കാം, ഇതിന് വലിയ ടെക്നോളജി ഒന്നും ഇല്ല. എങ്ങനെയാണ് ഒരാളെ പെട്ടെന്ന് കാർഡിയാക് അറസ്റ്റ് വന്ന കാർഡിയാക് മസാജ് കൊടുക്കേണ്ടത് പഠിച്ചാൽ we might save a life. If you go abroad, for example in Europe, for example in Amsterdam, every tram, every public transport system has got a defibrillator. And all you need is to open it and switch off.
Listen to them.
Yeah,
Listen to
it
their
will tell you,
thoughts.
okay, hands off, charge it to 200 volts, right? Press the red buttons, hands off, that's it. And it might save somebody's life. So, nammalippam parayunne ella sthalathilu, if you get a new job, you are joining a corporation, before they will ask, do you have a
BLS
BLS certificate, basic life support പഠിച്ചിട്ടുണ്ടോ? ഇല്ല, ശരി പഠിപ്പിക്കാം. It is cheap, it can be taught in about 2-3 hours, and you can sometimes save the life of a person with cardiac arrest. I think ഇത് ചോദിച്ച വളരെ ചോദ്യം ശരിയാണ്. We should teach people more and more life support systems.
Nice. Now Akshay Murali has asked me this question: is atherosclerotic genetic in origin?
The answer is yes and no. See, ഒരു കാര്യം നമുക്ക് മനസ്സിലാക്കേണ്ട, many of these diseases has a background in our genes. For people who are unaware about genes, നമ്മുടെ ക്രോമോസോമിൻ്റെ അകത്തെ we have something called genes. That is the workbook of how our body works. Right? Every cell carries a copy of a gene, and this determines how we respond to any stress or any situation. And the second thing would be the environment. അപ്പോൾ നമ്മുടെ ജനറ്റിക് ബാക്ക്ഗ്രൗണ്ടും നമ്മുടെ എൻവയൺമെൻറ്റ് വെച്ചാണ് ഒരു ഡിസീസിൻ്റെ ഔട്ട്കം ഡിറ്റർമിൻ ചെയ്യുന്നത്. ഓക്കെ, ഇപ്പം ഞാൻ സ്മോക്ക് ചെയ്യുന്നു, വേറെ ഒരാൾ സ്മോക്ക് ചെയ്യുന്നു, my genetic susceptibility to smoking for cancer ഉണ്ടെങ്കിൽ I may develop cancer, the other person may not develop cancer. Right. Now, എനിക്ക് susceptibility ഉണ്ട്, ക്യാൻസർ വരാൻ ചാൻസ് ഉണ്ട്, ഞാൻ സ്മോക്ക് ചെയ്യുന്നില്ല, ക്യാൻസർ വരത്തില്ല. So you have an environment and you have a genetic predisposition. Both are there. There are quite a few families. നമ്മൾ ചിലപ്പോൾ ചോദിക്കും ഫാമിലിയിൽ ഹാർട്ട് ഡിസീസ് ഉണ്ടോ, ഈ ഒരുപാട് പേർക്കുണ്ട്. അപ്പോൾ എന്തോ അത് ജെനറ്റിക്, ജെനറ്റിക് ഡ്രൈവർ. പക്ഷെ അതേ ഫാമിലിയിൽ ഒരാൾ പറയുന്നത് ഞാൻ സാറ് സ്മോക്കൊന്നും ചെയ്യത്തില്ല, ഞാൻ ഈ ഫാമിലിക്ക് എല്ലാവരും ഉള്ള കാരണം ഞാൻ രാവിലെ ഇറങ്ങി 2 കിലോമീറ്റർ ഓടിയിട്ട് വരും, ഞാൻ കണ്ടോ വെയിറ്റ് ഒന്നും ഓവർ വെയിറ്റ് അല്ല, എൻ്റെ വേസ്റ്റ് എല്ലാം കറക്റ്റാണ്. He will never get a problem. So, partly genetic, partly environmental. Environmental part നമുക്ക് alter ചെയ്യാം. ചില നമ്മൾ പറയും there are factors which you can't change.
Right.
For example, age, gender, genetics, yes. But we can change things which are environment related.
Okay. Next question is, what are the side effects of consuming statins for many years?
See, any drug, any medicine has got a side effect. Understand that if a medicine does not have a side effect, it has no benefit. No benefit. It is like pure placebo. So anything has a side effect. If you take paracetamol for fever, if 10,000 people take it, one person can give alteration of liver function, right?
Yeah.
So everything has a side effect. And we take a medicine only if the effect is far more than the side effect. Having said that, we should know the side effects of statins. One of them is muscle pain. You know, because people today read Google and everything, the moment we prescribe a statin, statin muscle pain has a character. Statin muscle pain can be diagnosed by looking at blood reports and make sure that there is a pain. Statin side effect. We also know that statins have some other effect, for example, liver function abnormality undagam. But overall, statins are pretty safe. Pande param statins കഴിച്ചാ ബുദ്ധി കുറഞ്ഞു പോവും, മെമ്മറി ലോസ് ഉണ്ടാവും, ഹെയർ ലോസ് ഉണ്ടാവും, ഇൻഫെർട്ടിലിറ്റി ഉണ്ടാവും, അതെല്ലാം തെറ്റാണ്. മേജർ സൈഡ് എഫക്ട്സ് ഒന്നുമില്ല. സ്റ്റാറ്റിൻസ് ആർ കൈൻഡ് ഓഫ് സേഫ് and hugely beneficial in people who need it. Okay, so be careful about side effects of any drugs, including statins, but then don't just stamp them as bad because they have got some side effects.
Thank you. One more question, it's a little different. So she asked me, WPW syndrome ഉള്ള ഒരു കുട്ടിക്ക് കൊടുക്കേണ്ട ഫുഡ് എന്തൊക്കെയാണ്? Like what kind of food can be given?
WPW syndrome or Wolff-Parkinson White syndrome, WPW, അതിൻ്റെ full form ആണ്. It's a syndrome where it's an electrical disturbance of the heart. ഇപ്പോൾ നമ്മുടെ ഈ റൂമിൻ്റെ വയറിംഗ് ഉണ്ടല്ലോ, സപ്പോസ് നമ്മുടെ ഒരു ഷോർട്ട് സർക്യൂട്ട് ആണ്, ഒരു സ്ഥലത്തിന് വയറിംഗ് പോയി വേറെ സ്ഥലത്തേക്ക് പോകുന്നു. അപ്പോൾ എന്തുണ്ടാവും, if there is suppose there is a spark, it may spread through the abnormal wiring. ഇതാണ് WPW syndrome. So WPW syndrome patientsന് പെട്ടെന്ന് ഹാർട്ട് ബീറ്റ് കൂടിയാൽ it can trigger off an arrhythmia. അപ്പോൾ ഫുഡായിട്ട് എന്തെങ്കിലും റിലേഷനോ ഒരു റിലേഷനും ഇല്ല. It is a disease which is by birth, and today we have excellent treatment whereby we can find out that abnormal wiring, we can go and burn it out. നമ്മുടെ റേഡിയോ ഫ്രീക്വൻസി അബ്ലേഷൻ RF എന്ന് പറയും, and that WPW is cured. WPW diagnosed by looking at the ECG, and we have very good treatment and cure for WPW not related to diet. But there is a point. If somebody with a tendency for palpitation, be it WPW, be it LGL syndrome or whatever, takes a lot of caffeine, for example,
Okay.
they have a tendency for faster heartbeat, right? അപ്പം സപ്പോസ് ഒരാൾ പാൽപിറ്റേഷൻ ഉള്ള ഒരാളാണ്, പെട്ടെന്ന് ബീറ്റ് വരുന്ന ടെൻഡൻസി ഉള്ള, ഒരുപാട് ഡാർക്ക് ചോക്ലേറ്റ് കഴിക്കുന്നു, അല്ലെങ്കിൽ വെരി സ്ട്രോങ് കോഫി 4 കപ്പ് കഴിച്ചു ബിക്കോസ് 4 പരീക്ഷയുണ്ട്. ഓക്കെ, അല്ലെന്നുണ്ടെങ്കിൽ നമ്മുടെ ഈ നമ്മുടെ ഷുഗറി ഡ്രിങ്ക്സ് എടുക്കുന്നു, കോലാസ്, റൈറ്റ്, ദേ കണ്ടെയ്ൻ ഹ്യൂജ് എമൗണ്ട് ഓഫ് caffeine. For example, things like Red Bull, why people take it? Because they don't want to sleep. So they contain a lot of caffeine. So if we take a lot of caffeine containing drinks, people with palpitation, the heart rate may increase and there may be a susceptibility to those palpitations. But diet has nothing to do with WPW syndrome.
ഓക്കെ സോ ഈ കാർഡിയോവാസ്കുലർ ഡിസീസ് എന്നൊക്കെ പറയുമ്പം നമ്മളെപ്പോഴും അതിനെ കോറിലേറ്റ് ചെയ്യുന്ന ഇസ് ടു ദ ഓൾഡർ പോപ്പുലേഷൻ. നമ്മൾ പറയും ഒരു 30s അല്ലെ നോട്ട് 30s, ഐ മീൻ ലൈക്ക് ടു ദ ലേറ്റ് 30s ഏർലി 40s മുതലുള്ളവർക്കാണ് നമ്മളങ്ങനെ അസോസിയേറ്റ് ചെയ്ത് പറയുന്നത്. ലൈക്ക് ഹാർട്ട് അസുഖം അവർക്കൊക്കെ ഉള്ളത്. So what would you have to tell to the younger population out here who are not even fearful to any of it? They are like chill about all these concepts. CVD ഒന്നും ഞങ്ങൾക്ക് ഉണ്ടാവത്തില്ല. So
I think that is, see, you should not take the confidence of somebody, but then the point is that when we see an heart attack today,
right,
or when we see an heart failure tonight, somebody coming with breathlessness to the intensive care unit,
yeah,
when did the disease actually start? If you see this huge tree, the seeds were planted at least 10 years back.
True.
In what way? By high blood sugar, by high cholesterol, high blood pressure, obesity, dysmetabolic syndrome, low HDL and whatnot.
right,
And that has come because of what? Because of our lifestyle, which we can't avoid.
right,
Today we do white collar jobs, all of us has got some kind of mechanized transport, car or scooter or whatever. We don't have time to exercise, we have bad kind of food, we are exposed to smoking. So what is happening is this lifestyle over time has given us diabetes, dyslipidemia, cholesterols and sugars and pressures and whatnot and obesity. Okay, so unless we start at the age of 20, we will not prevent a heart disease at 40.
oof,
Right. So the point is that we should start early, obviously not medicine, but understanding that today if I am healthy as a kid, today if I am taking part in sports and games, today if a girl is taking part in dancing and be active, that is a person, that's a lady who would grow up as a healthy citizen. In contrast, I don't play games, I don't go out, I don't jog, I don't run. I am instructed by my parents only to sit and study and get higher and higher marks. I become unhealthy. Right? So what we see is that it is entirely in the family. If I regularly morning get up and put on my sneakers and start running, my son will also join me, right? On the other hand, ഞാൻ വന്ന് ഹോസ്പിറ്റലിൽ പോയി കടന്ന ഉടനെ ടിവിയുടെ മുമ്പിൽ ഒരു പോപ്കോൺ വെച്ചിരുന്നാണ്, my son will also learn the same thing. So we see that there are families which are very healthy. A family health moves together. And we see families which are unhealthy. So I think this, inculcating this habit should translate down from the seniors, the grandparents, the parents and the children. But the treatment, not drugs, but the lifestyle change should start right at 20s so that we can prevent this bad disease 40s, 50s and subsequently much later.
okay. So from what you just said now, there was this question that popped into my head. Are you worried in the sense like ഇപ്പം ഒരു 10-year 15-year മുമ്പുള്ള ഒരു യൂത്തിൻ്റെ ലൈഫ് സ്റ്റൈൽ അല്ലല്ലോ ഇന്നത്തെ ഒരു യൂത്തിൻ്റെ ലൈഫ് സ്റ്റൈൽ, ദ കൈൻഡ് ഓഫ് ഫുഡ് ദേ ഹാവ്, ദ കൈൻഡ് ഓഫ് സ്ട്രെസ് ലെവൽ ദേ ഇൻഡ്യൂസ് ടു, എവറിഥിങ്, their environment has completely changed with technology and with things being so available around.
Correct.
So
I am very worried because of a couple of things. One, see, if you had 5 years back, if you had to go and had a fast food or food outside,
right,
you need to go to a restaurant and have that, right?
True, true.
Or and you can afford to do that. Suppose your mom, who is a housewife,
Right.
she had no way of
True.
going out alone and having food.
Those
right?
little happiness,
Today,
yeah.
all she needs to do is call Swiggy, right? Today, when the maid doesn't come, the housewife says, "Why cook? Call Swiggy or Zomato or delivery food, free food delivery, right?" So the fast food, വീട്ടിൽ എത്തിക്കഴിഞ്ഞു, നമ്മൾ പോയി കഴിക്കേണ്ട ആവശ്യമില്ല.
True.
But just a phone call and it has come back. Yesterday, I was showing my wife. We were sitting somewhere. A family was talking together and all that. The kid, because he was disturbing them, amma, was given a cell phone.
Right.
And for the next 1 hour, this kid was going on looking at the cell phone. Okay. So it's nice for a mom. ഒരു സെൽ ഫോൺ കുഞ്ഞിനെ കൊടുത്താൽ കുഞ്ഞ് ട്രബിൾ ഉണ്ടാകത്തില്ല, അവിടെ നോക്കിക്കോളും. But see, the child doesn't run, child doesn't get into a swing, child doesn't get into a seesaw or catch butterflies,
Right.
but looking at an LCD screen. So what kind of future are we giving our children? I am very, very worried, especially with the home delivery of fast foods. I am worried about the LCD screen, the cell phone. So
Everything's in a touch.
Everything in a touch.
Right.
And you know, it's so attractive. See, you watch a Tom and Jerry in a television, you will get stuck there, right?
True.
So the visual media is so strong that people get attracted. Why libraries are closing down? Why people are not reading books anymore?
True.
Because to read a book, you assimilate those letters in your head and create a character that needs huge number of neurons to be active. And that is how we have evolved as human beings, right?
Right.
Instead that you see something in the LCD that's ready made for you, it attracts you but takes away your creativity.
Well, sir, I guess all the questions, I've just finished reading all of them, every query I've got. So what are your final words to on the World Heart Day?
I think today is World Heart Day. It's a very auspicious day.
Yeah.
The logo is use heart for every heart. Okay, so what does it mean? It all means is that put your heart and soul in preventing heart disease in whichever way you can, in whichever location you can, in whatever levels you can. എന്ത് പറഞ്ഞാൽ ഇപ്പം ഞാൻ ചിലപ്പോൾ ഹൗസ് വൈഫ് ആകാം, അല്ലെങ്കിൽ ഒരു CEO ആകാം, ഞാനൊരു ജിമ്മിൽ പോകാം, അല്ലെങ്കിൽ റെയിൽവേ സ്റ്റേഷനിൽ പോകാം, ഞാനൊരു എയർപോർട്ടിൽ വെയിറ്റ് ചെയ്യാം, അല്ലാതെ ഹോസ്പിറ്റലിൽ ഡോക്ടർ ആകാം. എനി വേ വി ആർ, അതാണ് നമ്മൾ പറഞ്ഞ് ലൈഫ് സപ്പോർട്ട് പഠിക്കുക. We can probably try to save a person either who is suffering from a heart disease or educate a person so that he doesn't get a heart disease. And that is why it is said that put your heart and soul in it, in preventing a heart disease. So use heart for every heart. I think on this day we should remind ourselves that still, unlike what every people think, the problem is not cancer. Why? Because cancer vanda varum. You can prevent smoke-induced cancer, pollution-induced cancer, that's it. Baki cancer vanda varum. But majority of heart disease is preventable, provided you and me, we take a step 10, 20 years before the attack comes in or the heart problem comes in. And that is why all this talk that prevention is better than cure. And all this huge infrastructure that we have today, right from cath lab to all the high tech, is meant to treat a terminal component of the process, the heart disease. Let us join together today and take a vow that in whatever little way we can, നമ്മുടെ വീട്ടിലോ നമ്മുടെ ചുറ്റുപാടോ നമ്മുടെ സൊസൈറ്റിയിലോ നമ്മുടെ ഫാമിലിയിലോ, let us put our heart and soul in preventing heart disease. Thank you.
I guess we have come to a conclusion to this beautiful seminar or an episode where we had our special guest, Dr. Nair. He said everything so beautifully. Like I was quite excited reading the questions because they were very simple, very normal, common questions every simple man would ask. And sir explained it so beautifully, so like very organically that any one of us could understand. So it was a privilege to be here with you on the World Heart Day with this exceptional cardiologist and to actively participate in this event. And I guess that the most simple and the most powerful tool for prevention is to invest on your health and also to make sure on how you invest on your daily habits. Habits are the little habits you take today make that huge impact later. So the message is very simple and crucial. Listen to your heart and use heart for every heart. Thank you, sir.